Hey everybody, Phil here again from Japan. Yesterday I talked about the collapse of the medical system, the imminent collapse of the medical system here, and some of the issues. And then last night, they addressed that actually quite a bit on the news. And unfortunately, they've kind of taken the opposite approach to what I think they should, but, maybe it'll work out, we don't know. Instead of changing the policy of admitting everyone to hospital who has tested positive for COVID-19, what they've decided to do is up their game as far as bed space. So last night it was announced that the government has block booked over 210,000, yes, 210,000 hotel rooms across Japan. Now, this is kind of worrying because right now we only have 11,000 total cases here. So they've gone for, 200% of that in bed space. Now, I would imagine that not all of those rooms are going to be used for sick people, because what they were talking about last night on the news is that they don't have enough medical staff, obviously, to take care of that many extra people. So what they're going to do is have military and prefectural employees, in other words, like city hall workers, they'll do the night shifts at the hotels, hospital hotels. So those hospital hotels will be for people who are not so symptomatic and presumably, hopefully, do not need so much attention. Now you would say, well, why are they in hospital then? I don't know. So that's the plan, to get a ton of hotel rooms and put the positive testing people in there who are not terribly sick, and then the sick people will go into hospital. Again, the issue with this is that there's lots of issues, of course, but one of the things we have seen across the world with the treatment of this virus is that the earlier a person gets on some kind of ventilation or breathing assistance, and that doesn't have to mean the full, whole 9 yards. It can even just be a tight-fitting mask. The earlier a person is on that, the faster they recover and the less likely they are to develop serious symptoms. So if we're still having 7-day delays in getting a positive test result, and if we are overstretching the medical system like this so we can't focus on the people who need attention, those people who are sick are not going to get assisted ventilation as fast, I would think. It just seems logical to assume that, but maybe there's another way around it. So that's where we're at with that today. Also a stunning display of the disregard for the state of emergency yesterday. I'm going to try and put a rather lengthy, perhaps, news clip, 2 or 3 minutes, from yesterday's news broadcast here with the English translation. And you can see what's happening or what's not happening. It's incredible, especially if you watch the man on the street interviews in the parks in Tokyo and you look at the background, the number of people out in the park yesterday. For those of you who don't want to watch the clip that's coming up, there's no evidence that people are doing anything about the state of emergency. There's no evidence that there's fewer people in the park. There's nothing. There seems to be fewer people at work and fewer people in the downtown areas, but parks are still being crowded. So I don't know why that is. The message is not coming out strong enough, I think, that you have to stay home. You in Japan, please stay home. No, yes, but just stay home. Even try it just for one day. It seems not even possible for one day. And how about try it just for 1 week? Anyway, here's the news clip. And that's it for me for today. I'm trying not to do these every day because it gets to be a bit depressing, and I don't think you want to see me every day. But when something happens, I'll be here. Talk to you soon.
Yesterday's rain gave way to clear skies across much of Japan today. Parks in and around Tokyo attracted many people. But it is important to take steps to prevent the spread of the coronavirus when visiting parks and other outdoor places. Let's take a look. The skies were clear across much of Tokyo from early in the morning. Many people were seen strolling around and spending time together with their families in parks throughout the capital. This person says children need to get some fresh air at weekends, at least. He says they need an outlet for their stress while exercising social distancing guidelines. This person says he doesn't see much difference in the landscape between before and after the stay-at-home request was issued. Muneishi Takeya of Audio-Visual Communications says images show many people taking strolls, jogging, and doing other things at parks, and some sections seem pretty much crowded. This footage was filmed shortly after noon at Komozawa Olympic Park in Tokyo's Setagaya Ward. Big data show turnouts even picked up in some parks after the state of emergency was issued. This chart represents changes in turnouts at Komozawa Olympic Park. The color red shows it attracted fewer visitors on Saturdays, Sundays, and holidays. Meanwhile, the weekday turnout largely remained flat. The park even seemed to have had more visitors starting April 7th, the day after the state of emergency was issued for Tokyo and 6 other prefectures. This chart shows changes in turnouts at Kinuta Park in the same ward. There was no let-up in the turnout both at weekends and weekdays, except for a 3-day weekend from March 20th through 22nd, when many people went out to see the cherry blossoms.
なるべく公園でも水をかけて遊んでいただければと思いますので、はい、よろしくお願いします。
This park is in Tokyo's Mitaka City. City staff are patrolling the premises on a regular basis to remind people of coronavirus measures. This Mitaka City official says people are asked to comply with basic measures such as wearing masks and thoroughly washing their hands and avoiding the 3 C's: closed spaces, crowded places, and conversation in close proximity. The Tokyo Metropolitan Government and experts on infectious diseases say people are free to run or exercise in parks, but there are some things they should be careful about. Kaku Mitsuo is a professor at the Tohoku Medical and Pharmaceutical University and a specialist on infectious disease prevention. He has some advice for children and their parents. He says they need to be careful, as it would increase the risk of infection if many children play closely together, or if children touch their mouth with a hand that has touched playground equipment. Their parents need to watch them closely. And parents should also be careful not to create a crowded situation. Next are some tips for joggers. Some runners said they are aware of preventive measures, and some voiced concerns about running at parks. This man says he is running as he needs the exercise. He says he tries to keep a distance. This person says there are more runners, so she feels a little anxious when a runner she is passing happens to sneeze. Suzuki Tatsunori is a doctor and associate professor at the Tokyo University of Science. He enjoys jogging himself. He serves as director of the Japan Medical Joggers Association. Suzuki says there is no problem if you keep this distance, as no one would run looking sideways and speaking loudly at the same time. And he tells people to try not to be close together before and after jogging while warming up or changing clothing. He also advises them to avoid contact with others and not to run together with more than 2 people. He says the important thing is not to create a crowded situation. Wearing a face mask is also very effective, as a mask protects a runner from droplets and a runner can avoid unwittingly touching his or her mouth with a hand contaminated with viruses. It is recommended that people run at a speed at which they feel comfortable breathing through a mask. Suzuki says he thinks many people are running because the government allows such activity, but he says they need to be careful as they could create crowded situations with increased infection risks.